How long should baby be nursing? Should it be 5 minutes or an hour? Today, let's talk about that. Let's go. Be confident and successful in your breastfeeding journey. I know that I say it often, but every baby is different. One baby may nurse for 5 minutes and the next one for over an hour, and either way can be totally fine. Moms worry when baby's nursing a short amount of time, maybe I don't have enough milk, baby didn't stay on very long. Or they worry, baby's on a long time, maybe I don't have enough milk because they're taking so long to get it out. So mom's milk can totally be fine, and usually mom's milk supply is great, but sometimes baby is faster or slower at transferring milk. So if your baby's taking a really long time, be sure to see your lactation counselor so that they can check out if baby's position and latch is great. So we do want to be sure that baby is in a great position. Now, if the latch is off, that's usually painful. Breastfeeding should not be painful. It may be uncomfortable at times, but it should not be painful. But sometimes the latch is off and mom doesn't feel pain. So you still want to get checked out and be sure that baby's transferring milk well. Does baby have a tongue or lip tie or high palate? Something that's maybe making baby not get the milk transferred fast enough. But for some babies, everything is great and they still take an hour or slightly more to breastfeed. Some babies that nurse a really short amount of time, like 5 minutes, may be just really great at transferring milk. Those babies usually eat a little bit more often. We also want to be sure that baby's still getting enough, especially on a newborn baby. The way that you always know that baby's getting enough is by counting wet diapers. So a 1-day-old baby should have 1 or more wet diapers, 2-day-old, 2 or more wet diapers, 3, so all the way up to day 6. So a baby that is 6 days old and older should always have 6 or more wet diapers every 24 hours, and that's how you know that baby is getting enough to eat. If mom has a forceful letdown and oversupply, those babies can often eat in 5 minutes, but sometimes those are the babies that take an hour because baby is biting down to control how fast the milk comes out. A newborn baby should eat 8 to 12 times a day, but an older baby will start to slow down and not eat quite so often. The length of time and how often baby nurses can change from day to day and from morning to evening. A lot of babies will nurse more often in the evening. That's usually a fussy time, baby's not feeling so well, and mommy's arms and breast milk help baby to feel better. There's natural painkillers in your breast milk. If a mom has a condition called a forceful letdown and oversupply, that's where her milk comes out very quickly, kind of chokes baby. If mom has that condition, sometimes babies take a really long time to eat because they're biting down on the breast, trying to control how fast it comes out. But often, those babies will eat really quickly in about 5 minutes. If you think that you might have that condition, it's really important that you know and understand more about it. So I have a video series that I'll link above if you want to check that out. The first video will help you to determine if that's what you have. Another thing that I wanted to mention is that baby should nurse on both breasts each feeding. Now, we don't want to equal out the time like 15 minutes and 15 minutes. We want to put baby on one side, let them nurse as long as possible. When baby's slowing down and seems about done, then you'll switch baby to the other side. Baby might only be on that second side for a few seconds, or they might decide to eat a little longer. Either way is fine. The reason why we want to do this is that if baby's on both breasts each feeding, that really helps to increase and maintain your milk supply. So this is really important for a newborn, that it helps to establish your milk supply. But sometimes a newborn falls asleep and doesn't want to be awake for the second side. So you want to try when possible to get baby awake and to nurse on the second side, but don't get really upset if it doesn't happen. And then again, when a baby's older, they're too busy and they don't want to nurse on that second side. But when they will, try to nurse them on the second side. The reason why baby needs to be on that first side is because there's slightly more fat in the breast milk when baby's been on there longer. So when baby goes to the other side, they're still getting nutrients, but it's not as high a fat. So as long as possible on the first side. Then the next feeding, you'll start on the other side. I tell moms, trust your body and trust your baby, but you may still have some questions and concerns. If you do, just ask them below and I'll get back to you as soon as possible. Also in the description is a link to my private group called the Milky Way Inner Circle. When you join that, you have access to a library of videos and PDFs, plus to a private Facebook group where moms can ask me questions at any time. I hope this video has been helpful for you, Mommy. Thanks a lot. You got this.